Hello, my name is Adrian, and welcome to the Better Pill Podcast audio Samplex Series, where we dissect, analyze, and rationalize med school, PLE, and USMLE questions. Para lang tayong mag-group study sa coffee shop. Syempre, from time to time, we'll invite high-yield friends to help us with the ratio in our samplexes. Before we begin, go and grab a cup of coffee because this is gonna be a super high-yield session. Questions from this episode are provided by our friends from Ambos. Ambos is a very high-yield QBank and library. I am an Ambos user myself and I can vouch for it.
If you want to score higher in your exams and be more efficient, definitely check out Ambos. I'll provide the link in the description box.
Today, I invited a friend to help us in rationalizing our samplex. He's a very high-yield friend because he topped the board exam in MedTech back in 2014. And we have also featured him in our previous episodes in this podcast. So he really needs no introduction anymore. And he really is a very high-yield friend. Because back in med school, pag nag-aaral kami, marami siyang inputs. So friends, without further ado, please help me welcome Dr. Kym Sirilan. Morning.
Hi, good morning, Adrian.
Morning, Kym. How are you?
I'm good. I'm prepping for my next exam.
Which is?
My Step 2 CK.
Perfect. So, Kym kasi is currently preparing for the USMLE and he just took his Step 1, Kym, right?
Yes.
So, nag-aaral talaga siya ngayon, kaya marami talaga siyang input on how to approach questions and how to, answer questions, which is what we are going to do today basically. Kasi this is the very first episode, Kym, by the way, of the audio Samplex series. Basically, what we'll do is we'll go through questions and then analyze, dissect natin, see why one answer is correct, see why other answers are wrong. And then, basically, ganyan lang. Para nga lang tayong nag-aaral sa coffee shop before an exam. Okay, so are you G for this, Kym?
Oh, G.
Syempre. Okay, let's get down to business. Let's go to the first question, okay?
Yes, sure.
So, I'll read the question first. By the way, the topics for this episode are Physiology, Cardio-Pulmo na system.
Okay.
So the subject is physiology, yung system natin is Cardio-Pulmo.
Okay.
So
good
cardiovascular
luck.
physiology and respiratory physiology. Okay? Let's do this. First question. A 32-year-old man comes to the physician for a 1-month history of fever, chest pain with deep breathing, and a 4 kilo or 9-pound weight loss. His temperature is 38 degrees Celsius or 100.4 degrees Fahrenheit. An X-ray of the chest shows a subpleural nodule in the right lower lobe with right hilar lymphadenopathy. Microscopic examination of the right hilar lymph node biopsy specimen shows several granulomas with a cellular course. Which of the following is the most likely diagnosis? So here are the choices. A. Primary tuberculosis. B. Chronic berylliosis. C. Miliary tuberculosis. Or D. Pulmonary sarcoidosis. Again, I'll repeat the choices. A. Primary TB. B. Chronic berylliosis. C. Miliary TB. Or D. Pulmonary sarcoidosis. Okay, before you give your answer, Kym, can we first go back to the question and dissect it?
Okay, sure. So we have a man who has a 1-month history of fever, chest pain, and deep breathing and weight loss. So I think those are the pertinent signs and symptoms of our patient who is also febrile, right?
Yes. He's 38 degrees Celsius currently.
And on X-ray, the patient has I think the pertinent there is the subpleural nodule at the right lower lobe with hilar lymphadenopathy. And I think the
biopsy shows
how do you say this? I think the giveaway here is the biopsy of the lymph node shows granulomas with acellular cores.
Yes.
So my answer would likely be the primary tuberculosis.
So your answer is primary TB, letter
Yes.
A, and the correct answer is yes, primary TB. Okay. Why primary TB, Kim?
In America, they consider TB if you have symptoms of this fever, chest pain, and weight loss, as well as cough if it's like 3 weeks or more. But here in the Philippines, if it's 2 weeks of cough and other associated symptoms, we would automatically
consider TB agad, right?
TB,
2 weeks
yes.
na cough.
And I chose TB because the pathology clearly shows that there is a cellular course of several granulomas. So that's caseating necrosis. Right? So,
what if this was several granulomas with cellular cores? Pwede ba yun?
Actually, there is a disease that also presents with non-caseating, but that's not commonly seen here in our country. It's usually caused by sarcoidosis.
Yeah, and medyo similar din yung presentation, right?
Yes.
But dun talaga siya magkakaiba sa biopsy. Kasi caseating granuloma yung makikita sa TB, whereas sa sarcoidosis, cellular rather than acellular course yung makikita, right?
Yes. And then the other choice would be miliary TB, but we ruled out this because the X-ray didn't show any diffuse reticulonodular opacification or like the millet seed appearance. It's not the nodule in our patient is just located at I think it's in the right lower lobe. It's just focal.
Yeah.
Unlike miliary, it would show na diffuse siya because na hematologically spread na siya.
Exactly. And why primary TB? Why primary? Paano natin masasabing primary tong infection na to?
Because how do I say this? There is this the Ghon focus or the Ghon complex.
Yeah.
Which and then the location of the nodule is at the right lower lobe. If this is secondary TB, the caseation or like the pathology usually happens
yung lesion
at the
usually nasa apex ng lung,
of the
diba?
lungs.
Yeah.
Yes.
Okay, so this is quite a simple question lang, no? And it's very direct. Lalo na for us Filipinos na endemic yung TB in our country. And lagi itong tinatanong sa exams, really. So, again, 32-year-old man, may history of fever, chest pain, deep breathing. So, fever plus yung weight loss na 4 kilos. Tas, febrile siya, may subpleural nodule and right hilar lymphadenopathy. Plus, syempre yung dito, parang giveaway is yung granulomas with acellular cores. Parang automatic na kaagad na okay, this is TB. But sa choices natin, may primary TB, then may miliary TB. So, obvious naman na primary TB to because may Ghon complex and iba kasi yung radiologic appearance ng miliary TB, di ba? Parang may millet seed appearance. So, okay, primary TB. Nice. Very high yield si Kim, sabi ko sa inyo, di ba? Okay, let's go to the next question, Kim. Are you ready for question number 2?
Okay, I'll try my best.
Okay. Okay, so here's question number 2. A previously healthy 66-year-old woman comes to the physician because of a 3-day history of fever, cough, and right-sided chest pain. Her temperature is 38.8 degrees Celsius or 101.8 degrees Fahrenheit, and respirations are 24 per minute. Physical exam shows dullness to percussion, increased tactile fremitus, and egophony in the right lower lung field. The remainder of the examination shows no abnormalities. Which of the following is the most likely cause of these findings? Letter A. Collapse of a lung segment. B. Fluid in the pleural space. C. Fluid in the interstitial space. Or D. Consolidation of a lung segment. Let me repeat the choices. A. Collapse of a lung segment. B. Fluid in the pleural space. C. Fluid in the interstitial space. Or D. Consolidation of a lung segment. Okay, Kim, can we dissect the question muna before you give your answer?
Okay, so we have a 66-year-old woman because of 3-day history of fever, cough, and right-sided pain. So those are the signs and symptoms of our old lady there. And who is currently febrile at 38.8 and tachypnic at 24.
Yes.
On our physical exam, this is actually our map here. So dullness on percussion, increased tactile fremitus, and then egophony in the right lower lung field. Among the choices, I think if we diagnose this patient, maybe she has likely to have community-acquired pneumonia. And among the choices, I would probably choose the consolidation of lung segment based on our physical exam.
Yes, okay. So, risk factors nito, Kim, no? Elderly, tapos presenting with fever, cough, and right-sided chest pain, plus febrile pa siya, no?
Yes.
I mean, currently febrile siya, 38.8 degrees. And plus the physical exam, it will really point out to to pneumonia, no? Or community-acquired pneumonia in this case. So, sige, let's try to dissect the physical exam findings. I think ito yung dito important, no? Like, kasi, or no. Let's see na lang why the other. So the correct answer, yes, is consolidation of a lung segment. No, you're correct. Let's see why the others are erroneous, why they are wrong. So, collapse of a lung segment, letter A. What's collapse of a lung segment? Atelectasis, right?
Yes.
So what can we find on PE with atelectasis?
So, in patients with atelectasis, there is also actually dullness in percussion. But the difference in our patient, there is decreased tactile fremitus in
atelectasis.
Yes, no? In lung collapse. In our patient, there's increased. So, rule out kaagad yun.
Yeah. If I remember correctly, yung fremitus kasi, it's, when you, diba, how do we elicit this tactile fremitus? We ask the patient to say, tres, right? Yes. And then with our, the ulnar side of our hand, diba, you palpate on the chest, anterior and posterior. So, what happens is, if there is consolidation of the lung, mas nakaka-travel kasi yung vibration sa liquid or solid versus sa air. So, 'di ba, if there's consolidation of the lung, what composes consolidation ba? 'Di ba, yung pus, mga debris siguro,
mga fluid,
mga fluids ganun. So,
due to
what happens if
inflammation,
yung air nare-replace ng ganun?
Yes.
So, with pneumonia, we find consolidation. So, nag-i-increase yung tactile fremitus kasi mas nagta-travel yung vibration dun sa consolidated na segment. Whereas, if there is collapse of a lung segment, what happens ba if there's collapse?
Parang air na lang yung naiwan.
Parang, so less yung
vibration.
yung pag-travel, no? Oo. So, yun nga, decrease in tactile fremitus. So, dull din siya, no? But
Yes,
tactile
dull
fremitus will be decreased. Sa case natin, increase kasi si tactile fremitus. And egophony, can you give us an input on egophony, Kym? Kasi may egophony daw sa patient natin.
Egophony, alam ko, is when you listen to the patient's lung, when you have to ask the patient to say E, then instead of E, you can hear A on auscultation. And then parang, actually, word association lang to sa akin yung egophony. Parang, when I hear egophony, the first thing that I will consider is pulmonary consolidation. That's why I answered D.
Yeah, correct naman. So, yun nga. I think it's something to do with the frequency of the sound. There's, yung nagta-travel na frequency, nag-iiba because of consolidation. And I tried to search this before sa YouTube kasi pinakinggan ko talaga yung mga sounds before. So, yung tama nga, yung E, when you ask the patient to say E, parang nagiging A yung sound niya. You can try to listen sa YouTube, maririnig nyo. But of course, clinically, mahirap din siyang ma-distinguish talaga.
Yes, kasi different patients, parang different din yung
iba-iba din kasi yung
nila.
presentation talaga. And I don't think you can appreciate this in all the patients. But you can try to this in the clinic, especially during clerkship and internship. So, how about fluid in the pleural space, Kym? So, fluid in the pleural space will be
pleural effusion,
right?
Yes.
Which you can also find in community-acquired pneumonia, diba? It can be a complication of pneumonia. But why do we rule this out?
Same with the collapse segment. The fluid in the pleural space will also present with dullness to percussion. Tapos, kasi to, yung tactile fremitus ulit, it's decreased compared sa patient natin na increase yung tactile fremitus.
Yeah. So, again, because with fluid in the pleural space, parang you're putting more space between the visceral and parietal pleura. So, parang lumalayo yung lung from the chest wall.
Yes, kaya
so, actually, mas mahirap mag-travel nung... Kasi minsan sabihin mo, fluid in the pleural space, di ba this is liquid? So, it should transmit the vibrations more. Pero kasi, this is a different case. Yung fluid dito, it's in between the two layers of the pleura, right?
Yes.
So, mas lumalayo si lung from the chest wall. So, actually, parang nabablock niya yung pag-travel ng vibration. So, with fluid in the pleural space, decreased yung tactile fremitus. As a patient natin, there's increased tactile fremitus. Eto, Kym, fluid in the interstitial space. Yung choice C, why is it wrong?
Well, ang fluid in the interstitial space kasi dapat may crackles siya, no? Parang
usually, no?
Sa PE. Kaso lang, ang narinig natin is egophony. Tapos, how do I say this?
Well, you can have crackles din naman sa
well, oo nga.
You can have crackles naman in community-acquired pneumonia.
Pero kasi, pag fluid in the interstitial space, hindi siya one-sided.
Yeah, I think that's the more important point. So, fluid in the interstitial space is pulmonary edema. Usually, bilateral siya. It can have the same, medyo same yung presentation, no? There will be dullness din, right? And then,
increased
din yung tactile fremitus niya. Possible yun. And, I'm not sure about egophony, but the main point here is, yung sa atin kasi localized, 'Di ba? It's in the right lower lung field. Pag localized yung finding, it's more of infectious, no? Yung cause.
Kasi pag bilateral, ganun, siguro you think for systemic siya.
Yeah, exactly. So, yun. Actually, very direct question naman. Medyo madali lang din siyang sagutin. Pero dissect lang talaga natin para high yield. Kasi again, Kym is very high yield. Kaya let's take advantage of him while he's here. Okay, let's go to the next question, Kym.
Next question. Okay, fire away.
Okay, so question number 3. An investigator is conducting a study on hematological factors that affect the affinity of hemoglobin for oxygen.
Okay.
An illustration of 2 graphs, A and B, that represent the affinity of hemoglobin for oxygen is shown. So, later we'll discuss the graph na lang. Which of the following best explains a shift from A to B?
So,
yung graph is the oxygen hemoglobin dissociation curve. We can, syempre, hindi nila makikita kasi this is a podcast, no? But, basically, yung tinatanong niya is shift from A to B. And sa graph, there's shift from left to right. So, this question is asking for what causes a rightward shift in the oxygen hemoglobin dissociation curve. Okay, so, let me enumerate the choices. Letter A, decreased serum 2,3 BPG or bisphosphoglycerate concentration. Letter B, increased serum pH. Letter C, increased hemoglobin gamma chain synthesis. Or letter D, increased body temperature. Let me repeat the choices. A, decreased serum 2,3 BPG. B, increased serum pH. C, increased hemoglobin gamma chain synthesis. Or D, increased body temperature. Okay, Kym, can we dissect the question?
Okay, so we have a study here that basically differentiates the factors or tells us which factors causes shift to the left or shift to the right. But in this experiment, it asks us what factors or how do these factors increase or decrease will affect the affinity of the hemoglobin for oxygen. Sa study na to, we have shift to the right.
Right, yeah. So we're looking for a factor that that shifts the curve to the right.
Okay. So among the factors, meron kasi akong mnemonic na or like automatic siya na naiisip ko. Among the choices, no, feeling, I think the answer would be increase in body temperature. Yes. Yeah. Kasi among the other choices you mentioned, I think all of them causes the curve to shift to the left.
Yeah. So basically, what happens, Kym, right, is if the curve shifts to the right, yung x-axis kasi nito is partial pressure of oxygen, right? And then yung y-axis is
oxygen
saturation sa hemoglobin, right? So what happens is if there's a shift to the right, it favors the release of oxygen from hemoglobin, right?
Yes.
And if there's shift to the left, this would mean there's more affinity. So mas dumidikit si oxygen sa hemoglobin. Tama ba, Kym?
Yes, pag shift to the left.
Pag shift to the left, yeah. Yes. So your answer is increased body temperature, which is correct, no? Because if there's increase in body temperature, when does this happen? Diba usually fever or exercise,
yes.
Right? So what happens is this will really favor the release of oxygen. Siyempre, kung iisipin mo lang, no, hindi scientific na explanation, pero pag nag-exercise ka, dapat mas i-release mo yung oxygen sa exercising muscles mo, right?
Yes. Mas i-release mo siya from the blood kasi mataas yung
to the
demand
tissues.
Niya.
So, very easy question naman, fairly easy. But let's try to rationalize the wrong answers. why not decrease serum 2,3 BPG? What does 2,3 BPG do ba?
So your 2,3 BPG or your 2,3 bisphosphoglycerate binds to your deoxyhemoglobin. It actually reduces the affinity of oxygen, thereby increasing the available oxygen in the tissues. So, pag decrease yung BPG, dapat shift to the left siya.
Shift to the left, no? Kasi pag mataas si 2,3 BPG, mas nire-release niya yung oxygen. Pag mababa naman siya, mas increase yung affinity.
Yes.
How about increase serum pH? Meaning, the serum becomes more basic, right?
Basic.
Yeah.
So, pag nagiging basic yung blood natin or nagiging alkalotic ka, there are fewer hydrogen ions and there is a decrease in the, increase in the oxygen affinity to your hemoglobin because your hydrogen ions actually bind to your hemoglobin and then they reduce its affinity for oxygen. So, an increase in pH would cause a
decrease in H, diba?
Yes.
So more
left. More of left.
Oh. So, mas
oo.
more affinity. And then, increase hemoglobin gamma chain synthesis. What is this? What is hemoglobin gamma chain?
Hemoglobin gamma chain is actually a component of your fetal hemoglobin.
Mm-hmm.
And we all know that fetal hemoglobin is has higher affinity to oxygen than our usual adult hemoglobin, your hemoglobin A. Then, actually, hemoglobin F or your fetal hemoglobin causes the curve to shift to the left because, this is how your baby gets oxygen from the mother.
Yeah. Yeah, exactly. So, pag fetal hemoglobin, mas mataas yung affinity niya with oxygen, di ba? Kasi, imagine if hindi, edi less yung supply ng oxygen ni baby, di ba? So, kailangan yon. So, it really serves a function. Fetal hemoglobin has more affinity to O2 para makaka-extract siya ng oxygen from the mother. Okay, so the answer there is increased body temperature. May mnemonic actually which is increase lahat, 'di ba, Kim?
Yes.
Pag
shift
to the right, increase lahat. But then again, careful lang kasi meron kasing ibang like increase yung pH, shift to the left 'yun.
Yes. So yung akin naman is left low. So pareho silang letter L. So everything is low in shift to the left except for your pH.
Yeah.
But if you have low, except for pH which is increased, right?
Yeah.
Okay.
So pwede mong ipalitan si pH to H ions,
yes.
di ba?
Oo.
So instead of increase yung pH, gawin mo siyang decreased H ions. Para lahat sa left decrease. But then again, Kim, yung hemoglobin gamma chain, increase to and then left din. So, better that you understand talaga.
Yes,
right?
That's true.
It's really better if you understand. Pero yung mnemonics, it can be helpful sometimes as long as you understand talaga the concepts behind them. So, okay, let's go to the next question ba? We have 2 more?
Okay, go.
2 more questions.
2 more.
Okay. Very high, Kim. Thank you for accepting my invitation.
No problem.
Okay, let's go to question number 4. A 63-year-old woman comes to the physician because of a 6-month history of fatigue and shortness of breath on exertion, okay, in addition to a 1-month history of ankle swelling. She has a history of sleep apnea. Examination of the lower extremities shows bilateral pitting pedal and ankle edema. Cardiac exam shows a widely split S2 that varies with respiration. An ECG shows right bundle branch block. Which of the following is the most likely etiology of the patient's lower extremity edema? Okay? So, letter A, dermal accumulation of glycosaminoglycans. B, thrombus formation in a deep vein. C, increased capillary hydrostatic pressure. Or D, decreased plasma oncotic pressure. Let me repeat the choices first. A. Dermal accumulation of glycosaminoglycans. B. Thrombus formation in a deep vein. C. Increased capillary hydrostatic pressure. Or D. Decreased plasma oncotic pressure. Let's analyze the question first.
Okay.
What are the salient points in the question, Kim?
So we have a elderly woman, 63-year-old,
Yeah.
who presents with 6-month history of fatigue, right? Shortness of breath on exertion.
Yes.
And then who presents with 1-month history of ankle swelling.
Yeah.
On physical exam, we have bilateral pitting, pedal, and ankle edema with cardiac examination of widely split S2. On ECG, the patient has right bundle branch block. And so the question here is, what is the cause or the etiology of the patient's lower extremity edema?
Yeah.
Among the choices, go ahead. You go first.
Yeah. Among the choices, which is your top differential?
I would consider the letter C, the increased capillary hydrostatic pressure. Yes.
Yeah, and that's the correct answer, no? So, all the choices here, they cause leg and ankle swelling, no? All the choices.
Yes.
But to get to the right answer, we have to see sa salient po sa keywords natin or sa signs and symptoms ng patient kung anong etiology ng lower extremity edema niya. So, let's go to letter A and see why it's not the correct answer. So, dermal accumulation of glycosaminoglycans. When does this happen ba, Kim?
I think if this happens sa lower extremity, this is, I think, termed as tibial myxedema, which is usually seen in a portion of patients who has a thyroid disorder, like your Graves' disease.
Yeah.
Right? And then, in our patient, wala naman siyang pinakitang signs ng thyroid dysfunction, like temperature intolerance, weight changes or weight loss, or diarrhea, parang ganon. So, I ruled it out na din.
Yeah. Okay, how about thrombus formation in a deep vein? Or I think this is DVT, yeah. DVT.
Yes.
Why not DVT?
Well, in DVT, usually, there is, how do I say this? May mga risk factors, like kung may cancer ba yung patient, tapos on
bedridden,
ganun, oo. And then, wala naman ganun sa patient natin. And then, usually, pag may DVT, unilateral lang siya.
Yeah, usually unilateral legs and ankle swelling. And in our case, in the case of the patient, this is bilateral. But this can happen din naman, no? You can have bilateral DVT, but of course, this is very rare. No? And, yeah. Usually, yung tinatanong naman sa mga questions, hindi yung mga rare. Usually, these are the usual common presentations. And there are other findings in the patient which really point out to a different etiology ng swelling niya. So, how about letter choice D, decreased plasma oncotic pressure, Kim? Why not this?
Decreased plasma oncotic pressure usually is caused by liver failure or nephrotic syndrome. This is due to decrease in our albumin.
Yeah.
And then, in our patient kasi, wala naman siyang pinakitang signs na may liver failure siya. And then, at the same time, usually, pag decreased plasma oncotic pressure, yung edema mo is all over the body. Meron sa face, meron sa kamay, ganon. But in our case, ang sa patient is sa ankle lang, sa lower extremity. Which is usually seen din sa yung may mga heart disease. And then sa cardiac exam din, pwede mo nang masabi na most likely this is a right-sided heart failure.
Exactly. And So, review lang no ng listeners natin yung Starling's forces kasi it's a very important concept and you really have to master this kasi lagi siyang tinatanong and it's also very relevant clinically, no?
Yes. Ano to, actually parang isa sa mga high yield na things to remember in medicine.
So, with decreased plasma oncotic pressure, which is not seen in our patient, no, pag mababa yung plasma proteins mo, especially albumin, siya kasi yung parang
parang siyang nagpupull. It pulls the fluid inside
into the vascular system.
Yes.
Tama ba?
Mm-mm.
Yeah. So, if mababa yun, edi lalabas yung fluid from the vessels and it will cause edema and fluid retention. Ganun. So, the answer is actually increased capillary hydrostatic pressure. Why, Kim? Can you explain to us how in this patient, how increased capillary hydrostatic pressure occurred and why it caused edema?
So, first, no, parang isipin muna natin yung most likely diagnosis sa patient, which I think right-sided heart failure kasi at the same time the patient presented with right bundle branch block. Tapos on our physical exam naman na meron siyang widely split S2. This is likely na may delayed closure na no yung yung right-sided valves.
Yeah.
Tama? Yeah. I mean yung how do you say this? Yung
pulmonic valve.
Yung pulmonic valve medyo delayed siya because there's accumulation of fluid na. Tama? Parang ganun.
Why? Yeah, tama naman. So, parang delayed yung closure niya kasi
yung there is decrease in the how do you say this? The right ventricular output.
Yeah, syempre mas mas weak na siya. Mas nag-accumulate yung fluid doon and mas huli siguro siyang
nagko-close.
Yeah, kasi marami na yung blood dun sa right side. Tama ba?
Yes, parang ganun yung pagkakaintindi ko sa kanya.
Yeah.
That's why, tapos din, when there is, when patients have right-sided heart failure, ang nangyayari, yung blood is nagpupull siya sa ating venous system. When that happens, nag-i-increase yung capillary hydrostatic pressure sa veins. And one of the manifestations here is yun na nga yung pitting pedal and ankle edema bilaterally.
Yeah. That's correct. Just to compare left-sided from right-sided heart failure. Usually pag left-sided heart failure, usually lung yung symptoms, no, left for lung.
Yes.
Yun yung tinatandaan, no, eh. So, pulmonary edema, you can have shortness of breath also, etc. Whereas if right-sided heart failure, usually systemic yung edema or sa, like yun nga, sa pedal and ankle edema yung sa patient natin.
Yes, parang ititrace mo lang how the blood flows, tapos kung may sira yung sa left, so magba-backflow siya to the lungs. Pag sira naman yung right, so magba-backflow siya to the body.
Exactly. So, yeah. It's very important to know that you are able to trace the circulatory system also.
Yes.
And yung flow ng blood sa body. Okay, so let's go to the last question, Kim.
Sure. Go.
Okay, last question. Very high-yield, Kim, ha? Thank you talaga. Okay, last question. A 30-year-old woman comes to the physician because of worsening fatigue and shortness of breath for the past 7 months. She emigrated from China 2 years ago. On cardiac exam, there was a loud S1. Which of the following contributes most to this auscultation finding? Is it A, tricuspid valve opening, B, mitral valve closure, C, aortic valve closure, or D, pulmonary valve opening? I'll repeat. A, tricuspid valve opening, B, mitral valve closure, C, aortic valve closure, and D, pulmonary valve opening. So, dissect the question.
Okay, so we have so ano to guys, yung parang setting ng question kasi is pumunta siya ng US. So we have a patient na an immigrant from China who presented with loud S1. Parang with signs and symptoms of fatigue and shortness of breath. Tama?
Yeah.
So among the
For the past 7 months, so medyo chronic na yung
matagal na din. So my answer would be the mitral valve closure.
Why?
Well, first kasi among the choices S1 yung tinatanong.
Yeah.
And S1 is you'll just choose either if it's mitral or tricuspid. And when you hear the S1 and S2 sounds, this refers to closure of the valves, not opening.
Yeah.
So that's why I would answer the mitral valve closure. Yun yung parang likely, like in the first thing that came into my mind. Yun yung top 1 answer ko, the mitral valve closure.
The correct answer is, you're correct, mitral valve closure. Even if you just, like, kahit hindi mo i-analyze kung anong sakit to.
Yes.
You just say, loud S1. So, how you approached it, if you did not know talaga what disease entity this is, parang loud S1, okay. Tricuspid valve opening ba yun? I don't think so. Diba? Kasi
yes,
opening siya.
Kasi opening
mitral
siya.
valve closure, pwede. Aortic valve closure, pwede. Pulmonary valve opening, I don't think so. So, it's between mitral valve closure and aortic valve closure lang.
Yes.
But, aortic valve contributes to what heart sound? Not naman S1, diba?
To your S2.
S2. The aortic and the pulmonic valves contribute to S2.
Kaya,
so, yeah, you're correct. So, it's really mitral valve closure in this case. So, what disease is this ba?
I think what the question here pertains to a disease called rheumatic heart disease. This is usually seen in countries na developing. Parang sa Philippines, actually common din yung rheumatic heart disease sa atin, especially sa mga children. Usually, sequela to siya ng group A strep, tama, na disease. And this is usually a long-term na disease. Yung nagkakaroon ka ng rheumatic heart disease. Parang ang nangyayari is, isa sa mga common, long-term sequela is the hardening of the mitral valves. So, kaya siya naging loud or parang nagsisnap. Kaya para siyang, how do you say this? Mitral stenosis yung tawag natin doon. Tama?
Yeah, kasi, paano ba? Since matigas siya, parang maalala ko sa nito, Kym, is, paano ba? A loud S1 is often present because the increased left atrial pressure moves the mitral leaflets. Kasi, di ba stenotic yung yung mitral. So, there's increased left atrial pressure kasi matigas siya. Okay? And since increase yung pressure, mas paglabas na ng blood from the left atrium to the to the left ventricle, parang mas napupush niya away yung valves, yung mitral valve. And then, since mas malayo yung niya, napupush siya, mas malayo. So, mas malakas yung pag-shut. Parang, ang naalala ko sa lecture nito before, Kym, like, the door, no? If you open the door farther, then bang it, compared to if you just open it slightly and then bang it. Alin ba yung mas malakas?
Mas malakas yung mas malayo siya.
Yes.
Oh.
Parang ganun siguro yung
kaya siya loud.
Analogy.
Okay.
So, yeah. But very easy naman to answer this question because, yun nga, even with just the loud S1, yun lang yung keyword mo dun. Magigets mo na siya kaagad.
I think,
right?
Yes. Parang, kasi, hindi kasi, pag, the question kasi is tailored for USMLE, pero kasi parang emigrated from China, so, developing country. I'm not sure if developing pa siya, but, ganon. Parang ganon siya. Pag sa PLA kasi, hindi naman masyado tinatanong na galing China yung tao.
Yeah. Also, I'm not sure, correct me if I'm wrong, yung mitral valve din yung most commonly affected in this disease entity.
Sorry?
The mitral valve is the most commonly affected in rheumatic heart.
Yes, the
mitral valve. Yes. Tama ba?
Yeah, parang.
So, yun, Kym. That's the last question. Hopefully, this was a high-yield session. Hopefully, our listeners will learn a lot.
Yes,
diba?
Yes. Thank you very much for listening to The Better Pill. Don't forget to subscribe.
We have a Facebook page now. We also have a YouTube channel. And we're on Spotify. Please follow us, like, subscribe. If you want, if you have suggestions for topics, you can also email us or message us on Facebook or email us at thebetterpillpodcast@gmail.com. So, Kym, salamat, Kym, ha?
No problem.
Sorry sa istorbo.
Anytime.
Sorry I took some time off your step 2 preparation.
It's okay. Medyo matagal pa naman.
Tsaka related naman to sa preparation mo, diba? It's not like...
Actually, parang intertwined lang siya with step 1. So, this is a good review as well.
So, thank you, Kym. Hopefully, in the future, tatanggapin mo pa rin yung invitation namin.
No problem.
Thank you to our listeners. Thank you so much. Again, this has been Adrian. Catch us again next week for your refill prescription of The Better Pill.